Thank you very much, everyone. Thank you. Progress being made. And I appreciate you all joining us. Last night, the FDA announced groundbreaking new policies to further increase testing, very substantially so. All states can now authorize tests developed and used within their borders in addition to the FDA. So the states are very much involved. They have been involved from the beginning, but we're stepping it up as much as we can, and the testing procedures are going well. And within a short period of time, all of the private labs will kick in. This has never been done before, and it's going to be something I think it's going to be incredible if it's done properly. And these are great companies. These are among the greatest companies in the world, actually. So the state's going to be dealing through themselves and with local government, local physicians, local everybody. They're also dealing with us. But we have a tremendous testing capacity. Today, we're also announcing a dramatic expansion of our Medicare telehealth services. Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype, a historic breakthrough. This has not been done before either. In addition, states have the authority to cover telehealth services for their medical patients. And by doing this, the patient is not seeing the doctor per se, but they're seeing the doctor, so there's no getting close. During this time, we will not enforce applicable HIPAA penalties so that doctors can greatly expand care for their patients using telehealth, so the penalties won't be enforced. We encourage everyone to maximize use of telehealth to limit exposure to the virus. It's been a very successful method of communication, but never used on a scale like we're going to use at telehealth. And you'll be able to also better maintain hospital capacity by doing this. Earlier this morning, I spoke with executives from America's fast food industry, Wendy's, McDonald's, all of the big ones, Burger King, and they were great. We're talking about the pickups in light of yesterday's guidance you heard. To avoid eating or drinking at bars, restaurants, or public food courts. We discussed the important role that the drive-through pickup and delivery service can play in the weeks ahead. So that's happening, and they have been fantastic. They have been absolutely fantastic, and they've been doing it already, but they're keeping it open, and smaller staffs, very capable people and very capable companies, and they're doing it, pickups. Our guidance yesterday urges Americans to take action for 15 days to help stem the outbreak. So it's a 15-day period. I guess now would say it's a 14-day period. It's 15 days from yesterday, and we're asking everyone to work at home if possible, postpone unnecessary travel, and limit social gatherings to no more than 10 people. By making shared sacrifices and temporary changes, we can protect the health of our people, and we can protect our economy, because I think our economy will come back very rapidly. So it's 15 days from yesterday. We'll see what happens after that. If we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly, We have to fight that invisible enemy that, I guess, unknown, but we're getting to know it a lot better. Today, the Senate has taken up coronavirus legislation that includes free testing for those who need it, as well as paid sick leave and family medical leave for workers affected by the virus. We're also committed to getting small businesses the support that they need. In fact, one of the things we talked about with the fast food operations, we spoke to the chairman and CEOs of all of the companies, but one of the things we discussed is exactly that, getting small businesses support and flexibility that they need for themselves and for their workers, and that's being worked on right now. At my direction, Secretary Mnuchin is meeting today with senators on additional stimulus packages. I can tell you he was meeting with them late until the night last night, and for a big part of the day yesterday, and tremendous things are happening. There's great spirit, tremendous spirit, and I can say that for Republicans and Democrats. I can say that with respect to Governor Cuomo, we had a great talk this morning. We're both doing a really good job, and we're coordinating it. And we agree, different states need different things, and we agree on that 100%. But we had a very good talk, and I think we're right down the same track, and it's going to be very successful. New York has a pretty big problem, I guess, would be the #1 hot spot. That's no fault of anybody's. It's just the way it is. But we're working very closely together. We're also getting FEMA very much involved. They've been involved, but now we're getting them to a different level, and we'll have everything ready. We're dealing with the Army Corps of Engineers should that be necessary. We have them working in some cases, on standby in other cases. But my conversation with Andrew Cuomo was a very, very productive one and a very good one. I appreciate that. We're giving relief to affected industries and small businesses, and we're ensuring that we emerge from this challenge with the prosperous and growing economy, because that's what's going to happen. It's going to pop. One day we'll be standing possibly up here. We'll say, well, we won. And we're going to say that. Sure as you're sitting there, we're going to say that. And we're going to win. And I think we're going to win faster than people think, I hope. Later today, I'll meet with the leaders from the tourism industry, as well as industrial supply retailers and wholesalers, to discuss their critical roles. As you know, I met with the department store people, all of the retailers, the big ones, including Walmart and others. And it was a great meeting. They're stocking up their stores like they've never stocked them before. We're trying to get people to actually buy less, if that's possible. Buy less. Don't take everything. Just buy what you need for a while. They're going to stay open all hours of the day, and they've been fantastic. We're taking aggressive action now as one nation and one family so that America can rebound stronger, frankly, stronger than ever before. And we recognize that while many American workers can work from home, many others cannot. Many of our healthcare providers, first responders, and men and women in the food service and manufacturing are showing that they're showing up and standing up to provide us with the goods and services we need. So we want people to stay home where they can, but in many cases, when you talk about food service and manufacturing, certain items in particular, they're going in, and they're practicing all of the safety rules and regulations that we talk about. So with that, I'd like to just introduce our great Vice President, Mike Pence. He'll say a few words, and then I'll make some other introductions. Thank you very much.
Thank you, Mr. President, and good morning. It should be very clear to the American people that President Trump has initiated not only a whole-of-government approach, but a whole-of-America approach. And the President's interaction even today and through the course of this day with leaders in industry around the country reflects that we're not only bringing the full weight of the federal government to bear, but the full weight of the American economy. And I know I speak on behalf of the President when I say how inspired we are at the way the American people have stepped up and the way that American businesses, large and small, have stepped up. It's truly been inspiring. Our task force met this morning. We continue to focus on President Trump's priorities of testing, prevention, and supplies. And in that category, I'm pleased to report that while testing is available in all 50 states, as the President just indicated, through the swift action of the FDA at the encouragement of governors around the country, now state health authorities can authorize labs in their state and expand existing testing capabilities. But also in connection with the FDA's action, which you'll hear more about in a moment, we now have continued to expand the public and private partnership that the President forged with vast commercial laboratories around the country, increasing access to the high-volume, high-throughput coronavirus testing that is greatly expanding access even as we speak. Also, our task force received a report this morning on the progress that the U.S. Public Health Service and FEMA are making, working closely with state governments and also partners in the private sector like CVS, Target, Walgreens, and Walmart to expand remote testing sites around the country, and we'll have a full report later this week as those come online. It's important the American people understand that testing is happening all over the country, but all of our health experts wanted me to tell the American people, you don't need the results of testing to know what you should do. And President Trump's 15-day coronavirus guidelines are advice for every American in every community. They're the result of the best guidance of CDC and our health experts. And as the President said, we continue to urge every American over the next 15 days to put into practice the principles in the President's coronavirus guidelines. By every American practicing these principles, we believe that we can slow the spread of the coronavirus. In fact, our experts have told our task force that if every American acts on the President's coronavirus guidelines, we could see a substantial reduction in the spread of the coronavirus. But as the President said, it will take all of us to do it. And so if you feel sick, stay home. If someone in your house tests positive, keep the entire household home. Especially if you're a person with an underlying health condition, we urge you to stay home and practice social distancing from people. No social gatherings of more than 10 people. Use drive-through, as the President discussed with leaders in the industry today, and every American, especially practicing common sense and good hygiene. For the American people as a whole, the risk of serious illness remains low, but we're asking every American to partner with us in this effort to slow the spread of the virus, and especially to be mindful of seniors or others with serious underlying health conditions for whom the threat of the coronavirus can be very significant and very real. As I said, the President has continued to push our task force to bring a whole of government, a whole of America approach, and we continue to be inspired the way our nation's governors and nation's businesses are responding. We spoke just yesterday with the leaders of every broadcast network in America that will soon be unveiling a public service campaign using CDC guidelines. And specifically, as we work on the issue of supplies, meetings yesterday with Department of Defense officials about excess supplies. The President and I will be meeting today to speak about the supply chain for hospitals. We would make one specific request, and that is we would urge construction companies to donate their inventory of N95 masks to your local hospital and forego additional orders of those industrial masks. Because of what the President asked to be included in legislation moving through the Congress today, those industrial masks that they use on construction sites are perfectly acceptable for healthcare workers to be protected from a respiratory disease. But we're asking construction companies that our President knows very well from his background, we're asking them to donate their N95 masks to their local hospitals and also forego making additional orders. At the President's direction, we will continue to do whatever it takes. We'll continue to marshal the best of the American people, the best of all the people behind me, the people behind them, our state and local officials, and we will get through this, and we will get through this together. Thank you, Mr. President.
I want to thank Chad Wolf and Homeland Security. The job they did at the airports was really incredible. They screened thousands and thousands of people. O'Hare got backed up a little bit, but they got him out. But everybody was screened and screened very carefully. They didn't want to rush it. I think it was 13 airports, and it was an incredible thing. Then they had a big surge also from the UK and Ireland, and that went very smoothly. But they did a fantastic job. They worked long hours, and they did a fantastic job. I'd like to introduce Steve Mnuchin, and then I'm going to ask Steve to leave because he's going to the Hill. He's been working very hard with the Senate and with the House on a very, very big, bold package. It's going to be big and it's going to be bold, and the level, again, of enthusiasm to get something done, I don't think I've ever seen anything quite like it. So, Steve Mnuchin, please.
Thank you, Mr. President. I'd like to announce some very significant actions that the President has approved today. The first I would say is earlier today, I sent a letter to Fed Chairman Powell approving his request to use 13.3. And what that will do is the Fed will be setting up a special purpose vehicle, which the Treasury will invest $10 billion in from one of our funds. That will enable the Fed to guarantee the purchase of A1P1 commercial paper going forward. That is a $1 trillion market and is critical to American workers, it's critical to American business, and it's critical to American savers who have a lot of that money in money market funds. So we heard loud and clear there were liquidity issues. This is very significant. and will create, I don't think we'll need to use it all, but we have the ability to have the Fed purchase up to $1 trillion of commercial paper as needed. That has already created significant stability in the market today. The second thing I would say is, we've previously talked about deferring IRS payments. The President earlier this morning authorized me to announce this program. I have previously announced we would defer $200 billion. The President suggested we increase that to $300 billion, which we will be doing. Now, let me just be clear on the specifics. We encourage those Americans who can file their taxes to continue to file their taxes on April 15th, because for many Americans, you will get tax refunds, and we don't want you to lose out on those tax refunds. We want you to make sure you get them. Many people do this electronically, which is easy for them and easy for the IRS. If you owe a payment to the IRS, you can defer up to $1 million as an individual. And the reason why we're doing $1 million is that covers lots of pass-throughs and small businesses, and $10 million to corporations, interest-free and penalty-free for 90 days. All you have to do is file your taxes. You'll automatically not get charged interest and penalties. Now, of course, any American has the right to extend their taxes. We're not taking that right, but the President has asked us to go up to $300 billion. That's also an enormous amount of liquidity in the system. The third thing is the President and I worked on a very significant economic stimulus plan. Thank you for being available last night and throughout this morning, and I will be presenting that to the Republicans in the Senate this morning, and also discussing that with the House. We look forward to having bipartisan support. We're now working with the Senate to pass this legislation very quickly, and these will be payments to small businesses. We've talked about loan guarantees to critical industries such as airlines and hotels, and we've also talked about a stimulus package to the American worker. You can think of this as something like business interruption payments for the American workers. Thank you.
Do you have any questions for the Secretary of the Treasury?
When you say a stimulus package for American workers, do you mean direct payments to Americans, or are you talking about a payroll tax holiday?
Although the President likes the idea of the payroll tax holiday, I will tell you what we've heard from many people, and the President has said we can consider this. The payroll tax holiday would get people money over the next 6 to 8 months. We're looking at sending checks to Americans immediately. And what we've heard from hardworking Americans, many companies have now shut down, whether it's bars or restaurants. Americans need cash now, and the President wants to get cash now. And I mean now, in the next 2 weeks.
How much?
I will be previewing that with the Republicans. There's some numbers out there. They may be a little bit bigger than what's in the press.
Go ahead, please. Please, wait, please.
What help are you going to give to airlines specifically?
I've had discussions with all the airline CEOs this week. The airline CEOs have had conversations with the Senate and the House. As the President said, I was up with a subset of the Republican senators last night. I've discussed that with them. I think, as you know, this is worse than 9/11. For the airline industry, this is, they are almost ground to a halt. The President wants to make sure that although we don't want people to travel unless it's critical, we want to maintain for critical travel the right to have domestic travel.
$50 billion, is that enough?
I'm not going to comment on the specifics. I will tell you we're very focused. There's a lot of workers. This is strategically important to us, and we'll be working with Congress on this.
The airline industry will be in good shape. Yeah, go ahead, please.
There's been talk about $1,000 checks to every American, increasing support among Republicans and some Democrats for that. Would you support that going to everyone, or would you support some sort of income restriction on who gets a check?
Well, I think it's clear we don't need to send people who make $1 million a year checks, okay? But that's one of the ideas we like. We're going to preview that today, and then we'll be talking about details afterwards.
Well, I think we're going to do something that gets money to them as quickly as possible. That may not be an accurate way of doing it, because obviously some people shouldn't be getting checks for $1,000. And we'll have a pretty good idea by the end of the day what we're going to be doing.
Mr. Secretary,
Yeah, John,
Can you tell, how would the mechanics of this work? I mean, we've been talking about a payroll tax holiday, some $500 billion worth was floated to me today. But so how would this idea of sending people a check work? Would you Would that be sort of an advance on what they would pay in payroll tax? Or how would it work?
Again, we want to make sure Americans get money in their pockets quickly. We want to make sure small business owners have access to funds. We want to make sure that hotels, airlines, we have an entire package. We'll be laying out those details later today.
Yeah, I have to say this, there are 4 different ways you can do it. That's okay. 4, you can hear me well enough, I imagine.
Sorry.
Okay. Oh, people at home, you're right, those are very important people, come to think of it, especially your people. Look, we have 4 or 5 ways we can do it, 4 ways in particular. I think there's a 5th possibility, but there are some very good ways of getting the money out and getting it out quickly. Payroll tax is one way, but it does come over a period of months, many months, and we want to do something much faster than that. So I think we have ways of getting money out pretty quickly and very accurately. Okay?
Can you talk about the timeline, please? How quickly do you think you can get this done? And while
The
there is
President
broad
has
bipartisan
instructed me,
support
we have to do this now. So this is now.
by the end of the week?
We are going to work with the Senate, who's in session right now, actively. We will continue to have conversations with the House. I've already spoken to Speaker Pelosi once today. This is stuff that needs to be done now. The President has instructed me that this is no fault to American workers. For medical reasons, we are shutting down parts of this economy, and we're going to use all the tools we have, as I've said, and what tools we don't have, we're going back to Congress.
We've seen
I got to go back to
$850 billion. To those who might be concerned that's too expensive.
We don't want to talk about it, but it's a substantial number. We're going big. The expression, we could do it 2 ways. We could keep going back every day or every week. We're going big, and that's where Mitch McConnell, that's the way he wants to go. That's the way I want to go. I think we want to get it done and have a big infusion as opposed to going through little meetings every couple of days. We don't want to do it that way. We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing. We don't want, with this invisible enemy, we don't want airlines going out of business. We don't want people losing their jobs or not having money to live when they were doing very well just 4 weeks ago. So we're going big, and that's the way it'll be, and that's the way everybody seems to like it on the Hill. Any other question for Steve?
Sorry, in addition to airlines and hotels, you had a call with restaurants today. Was any type of emergency assistance discussed on that call? A lot of restaurants have to close. Even if they are doing delivery, they're not making as much money as they would with a full house.
Let me make 2 comments on the restaurants, and the President understands this. This was emphasized this morning. First of all, we want to make sure that the states allow the drive-through portion of these fast foods to stay open, particularly in a time period where we're telling people don't go to restaurants. These companies feed a big part of America, and I expect they're going to feed a bigger part of America. The second thing they asked me to emphasize, I wasn't going to do it now, but as long as you asked, many of these companies have apps. You can order ahead of time. That way, when you get there, it's as simple as they'll have it packed. They can give it to you with social distancing, and it'll be very fast. So we expect that they will be able to feed a large part of the population. And in regards to support, I will say a lot of these businesses are small businesses, are companies, franchisees, 500 or less, and we have a specific program we'll be unveiling that helps all businesses, small and medium-sized businesses of 500 and less.
Secretary, real quick question regarding Marriott Corporation. It announced that it is furloughing thousands of individuals because of the impacts of the coronavirus. Will your legislation help those individuals?
I hope so. That's one of the reasons why we got to act very quickly, because we understand whether it's the airlines, hotels, for good reasons to protect the United States on medical issues. These businesses are shut down, and the President wants to make sure, as I've said, we will use all the powers we have. You saw this today, $1 trillion of potential liquidity into the market, and the powers we don't have, we're going to Congress. And I will say there's a lot of bipartisan support for these issues. So I'm going to apologize because I have to go deal with some other things, if that's okay, Mr. President.
Thanks, Steve.
Oh, yeah,
Go ahead.
I do want to comment on this, okay? We absolutely believe in keeping the markets open, okay? Americans need to know they have access to their money. After September 11th, the only reason why the markets were closed was because the technology was disrupted. I've been on the phone with the major banks, with the New York Stock Exchange. Everybody wants to keep it open. We may get to a point where we shorten the hours if that's something they need to do, but Americans should know that we are going to do everything to make sure that they have access to their money at their banks, to the money in their 401ks, and to the money in stocks. So I want to just be very clear, we intend to keep the markets open.
And the banks are record-setting strong, so we have that, which is a much different event than what we had not so long ago. John, go ahead, please.
Mr. President, you mentioned the Army Corps of Engineers.
Right.
That you've had a conversation with Governor Cuomo.
Right.
He believes that New York is going to run out of hospital beds. Are you prepared to mobilize the
Well,
Army
we've
Corps
been asked to.
increase capacity?
Yes, we're starting to. We're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary. The state is working on it very hard themselves, but we'll probably supplement what they're doing.
And given that many of the precursors for our pharmaceuticals come from China, and there have been supply disruption, that supply chain has been broken to some degree. Do you expect that we could run into a shortage of prescription drugs?
No, I don't see that at all, and I think China has every incentive to make sure that things work well. China wants to make sure that things work very well. They have every incentive to do so. John?
Mr. President, the governor of Ohio has called off the election that was supposed to happen today, the primary election. Do you agree with that decision, and what steps are you taking to ensure that elections going forward, if this pandemic continues, that elections will be able to happen, including, of course, the big one in the fall?
Well, the governor of Ohio is doing a great job. He called that off, and we'll see what happens. There's a court case, and it hasn't been fully determined yet. But if he called it off, I could understand that because, you know, he's definitely somebody that knows what he's doing. We'll be seeing what very soon. You know, they're going by the rule of 10 as opposed to 50, and that's pretty tough. I would say probably you could violate that if you wanted to for an election. I just think an election is a very special thing. He chose a different date, I think a date sometime in June. But that would be a decision that would be made by him. He felt it was necessary. The courts somebody's challenging it, so the courts will ultimately decide.
Well, what are you doing to ensure that further elections, if we're still in this situation a month from now, 2 months from now, you
What I'm
suggested July,
doing,
what do we do?
what I'm doing, John, is very simple. We're getting rid of this virus. That's what we're doing. That's the best thing we can do. By the way, for the markets, for everything, it's very simple solution. We want to get rid of it. We want to have as few deaths as possible. This is a horrible thing. You look at what's going on with Italy. We don't want to be in a position like that, but a much larger, because we're a much larger country. We don't want to be there. And I think we've done really well. I think we've done well. I think the states have done well. We're all working together. The best thing we can do is get rid of the virus. Once that's gone, it's going to pop back like nobody's ever seen before. That's my opinion, but I think it'll pop back like nobody's ever seen before. Please.
Mr. President, just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right. We've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government. Now, we've knocked out all of the bureaucracy. It's very direct, but it's still always faster to order directly. And I gave them, that was totally misinterpreted by the New York Times on purpose, unfortunately. But it's very important. Yes, Mike?
I could amplify.
Yeah, please.
Yeah, thank you. Our president directed us to work with the Department of Defense. There's two ways that DOD can be helpful in terms of expanding medical capacity. I know the governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the president also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we could move. And as governors make these requests, we will process them, bring them to the president. But there are two different lanes that DOD can provide, in addition to many medical supplies to augment our national reserves. And the president has tasked us to evaluate, make available, and to consider every every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
The Army Corps is very prepared to do as we say, and we're looking at where it's going. But, and they do call them MASH hospitals, but the field hospitals go up very quickly. We have them, we have all of this equipment in stock, and we're looking at different sites in a few different locations. And we're not going to need them in West Virginia, where so far I guess they have none. Still none? Still none, right? West Virginia. Big Jim, the governor's, he must be doing a good job.
Or is that just reported?
That's what's reported.
No, but is that a reporting issue, or is that they have no cases?
Well, that's all that, I just see West Virginia is the only one that has no cases. So obviously, that's being treated differently than in New York or California, different parts of California. I do say this, though, the Army Corps of Engineers is ready, willing, and able. We have to give them the go-ahead if we find that it's going to be necessary. We think we can have quite a few units up very rapidly. I'm going to work with Governor Cuomo. I'm going to work with a number of the governors. Governor Newsom has been very generous in his words, and I'm being generous to him too, because we're all working together very well. And I think a lot of very positive things have taken place. We're talking to California about different sites, but we can have a lot of units up fairly quickly if we think we need them. I think what I'll do is I might ask Seema to say a few words on the telehealth, and then we can get back to this, please. Seema?
Thank you, Mr. President. And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also be provided in a variety of settings, including nursing homes, hospital outpatient departments, and more. And thanks to the leadership of HHS, we'll also be temporarily relaxing certain HIPAA requirements so that doctors can provide telehealth with their own phones, and we'll be using enforcement discretion when it comes to collecting copays so that cost won't be a barrier. This is a part of our larger efforts around mitigation, and as we are encouraging Americans to stay home whenever possible, we don't want our Medicare policies getting in the way. And so consider the implications of this. Perhaps an elderly patient with diabetes needs a routine checkup, and this has nothing to do with the coronavirus. And so with our new telehealth benefits, this person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor via Skype, and they don't have to risk exposure to the virus, and they can receive that care from the safety of their own home. It could be another Medicare recipient who's experiencing mild flu-like symptoms, and instead of leaving the house and sitting in a waiting room full of other vulnerable people, they can also receive advice from their doctor from their home. And this shift is very important for clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to, and this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that they need during this outbreak and limiting the spread of the virus, the impact of this historic action simply cannot be overstated. In an emergency, those on the front line shouldn't have to worry about federal rules and red tape. hamstringing them when they need flexibility above all else. And we're doing everything in our power to make sure that that doesn't happen. I also just want to briefly mention that because of the President's emergency declaration, we do have the ability to provide a lot of Medicaid waivers, and Florida was the first state to be approved. We were able to do that in a matter of days. Thank you.
Any questions, please?
Where do senior citizens go for instructions on how to do the telehealth?
They should call their doctor's office, and their doctor's office can tell them how to do that. Also, there may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay
Will
away.
you be posting numbers also?
That's correct,
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Thank you. Thank you very much. Admiral, if you'd say a few words about where we're going, and then I'd like to ask Dr. Birx to say a couple of words, but how the system's working.
Well, thank you very much. As we talked about earlier this week, the commercial system is rapidly advancing in the testing capabilities. As of today, our public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests, so almost 32,000 tests. The clinical laboratories, the Association of Clinical Laboratories, have reported out about 27,000 tests, and most importantly, of those 27,000 during the cumulative period of time, 8,200 of them were yesterday. This is showing the dramatic ramp as the high throughput comes in. We don't have the numbers this morning from the American Hospital Association, which means all the individual hospital laboratories. We will have that upcoming in the next day or so, and then Ambassador Birx will have this whole process fixed with the legislation that everything will roll up into a common reporting probably by the end of next week. In terms of our drive-through laboratories, again, these are blossoming all over the country by individual states. The ones that we are heavily involved in and really pushing equipment to, we expect over the next few days to begin setting up 47 of these in approximately 12 states. The material is already palletized and being shipped to the locations. Most cities have the specific locations. Some do not, but it's still going to a central receiving. And we know that we'll be deploying at least 140 Commissioned Corps officers. About half of the sites have reported their requirements. About 140 officers will be going. We expect that to go up. So this is going on the way we expected. We did a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you, Mr. President.
Thank you very much. Thank you, Admiral. And this has never been done before, and it sets a great roadmap for future. Should we have something like this in the future? I hope we don't. But it's never been done before, and they've done an incredible job. And again, we're working with the states and relying on the states. We have to, because they have, it's point of sale, it's point of sight, and we're in, I think, just about every instance getting along really well with the states. If I could, Dr. Birx, if you could say a couple of words, please.
Great, thank you. Thank you, Mr. President. So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governors' requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the President says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high-quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied and studied by the FDA to really ensure that they are that level of quality, and we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype-type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings, and I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
It's a big thing.
Doctor?
Maybe a couple of questions.
Yeah, so a question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are? Who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died?
Well, you are singing my sheet of music. I'm very data-oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that, and also importantly to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this pandemic.
Will you commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Birx, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive. But there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not? Okay.
So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the President asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
And we've been very tough in those states. I know exactly who you're talking about. We've been very tough in them. Thank you. Please, go ahead.
A follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology push out those tests. Because we can only make them available, groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable, that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
And the states are actually doing a lot of it. The governors and the states are doing a lot of it, with even our tests. Yeah, go ahead. Go ahead, please.
Okay, thank you. Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. But they all have their favorite inputs, and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's possible. It's possible. We'll see how it goes. I think there's been great cooperation with local governments, states. We'll see how it goes. It's going right now pretty well. Yeah, please, go
Can I
ahead.
follow on that, Mr. President,
Please,
very quickly?
yeah.
Just very
Go
quickly.
ahead.
Do you need to invoke the Defense Production Act to get more of those medical supplies to different
Well,
hospitals?
we're able to do that if we have to. Right now, we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually. We'll make that decision pretty quickly if we need it. We hope we don't need it. It's a big step.
Need more help from the federal government
Well,
when it comes to those supplies.
You know, when you
What
say
do
the
to those
states,
governors?
in particular, 3 states need some help. And some states, have 2 people, 3 people, no people, in the case of, again, West Virginia. So we're looking at it very closely. We've taken it apart 15 different ways. It's a very difficult thing to do. It's a very big step, and if we need that step, we'll take it. Okay?
Quick follow-on, Kristen's first question. A lot of people have got travel to places that aren't considered hotspots,
Yeah.
Caribbean, Mexico, that sort of thing over the next few weeks. Would you recommend that they follow through with those plans?
I would just say, enjoy your home stay. I would just say right now, we have to get this problem fixed, and then we'll get back into business really quick. We'll open up our country, we'll open society, the world will hopefully open up. We see areas of the world that haven't done well, and we see areas that are doing very well. And I would put us in the category of doing very well for a country so big. I think that I would recommend that they just enjoy their living room. John? Yeah, go ahead, please.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people
Yeah, sure.
that Dr. Burks.
I'm not happy with those people if they're not. But, you know, those people are being shouted down by other people. They know it. They're being, it's almost like self-policing. People went in, there are a couple of instances, I guess, probably more than a couple, where people are not happy when they see others doing what they're not supposed to be doing. We have to get rid of this. We have to win this war.